Hello, I'm Dr. Jeremiah Brown, and I'm a retina specialist in San Antonio, Texas. I'm here to talk with you today about the importance of early detection of age-related macular degeneration. As you know, macular degeneration is an age-related disease. That means it becomes more prevalent as we become older. One of the earliest features of macular degeneration are little yellow deposits that your eye doctor will be able to identify in the retina. In the early stages, you may have no symptoms at all. However, there are things that can be done to help slow the progression. As time progresses, these deposits may become larger, you may get areas of thinning of the retina due to these deposits, and people will start to notice some blurring of their vision, some wavy lines, maybe in some small blind spots. We know that there are some effective ways to help slow the progression. Number one, you want to wear a good pair of sunglasses when outdoors. Make sure that they block all UVA and UVB light from the sun. Number two, eat a healthy diet with plenty of green leafy vegetables like spinach and kale. And also try to have some fish in your diet, particularly fish like salmon and tuna, the more oily fish. These will help slow the progression of the macular degeneration. And lastly, do not smoke. Smoking can definitely accelerate the rate of progression of macular degeneration. Now, in some patients who have that dry form of macular degeneration, they progress on to what's called the wet form. In this form, little blood vessels start to grow up into the retina. They leak, they bleed, they form scar tissue, and the vision can decline dramatically. Whereas in the dry form of macular degeneration, the visual changes are slow and progressive over many years. In the wet form, a patient can lose their vision or have changes in their vision in just weeks or even months. This is why it's so important to detect it early. The reason to detect it early is we have very effective medications that can slow the progression of the wet macular degeneration and preserve your vision. So what are you looking for? You're looking for new distortion in your vision, new blind spots, more difficulty focusing. This would happen over a pretty short period of time when it's the wet form. So you might notice from 1 week to 2 weeks later that things are more difficult to do that you enjoy doing in your daily life. If you see these changes, particularly distortion, let your eye doctor know. With these medications, we are able to treat the wet macular degeneration in the office on a schedule depending on how you're progressing. The earlier it's treated, studies have shown, the more likely you are to maintain your vision. It's very interesting to note also that in patients who are coming to the office regularly and having their treatments in one eye, if they develop the wet form in their other eye, it's detected earlier. Many times we detect it in that second eye before the patient's even aware of the change. If you treat at that stage where the lesion is small and the visual changes are minimal, a person can maintain excellent visual acuity. So the importance of early detection is number one, you want to know if you have macular degeneration. So that just takes having a regular eye exam looking for these small deposits in the retina. Number two, if you progress to the wet form, if you're seeing distortion, new blind spots, you want to get the treatment at your retina specialist's office early because you will have better vision in the long run. Thank you for watching this video, and I've enjoyed speaking with you. Have a great day.